Hi everyone and welcome back to Health First. Today I'm here with Dr. Mittal, who is a pediatrician at Downstate Medical Center. Hi Dr. Mittal, how are you?
Hi, I'm good, Emily. Thank you for inviting me.
Thank you so much for joining me. I would like to start off by asking you what influenced you to go into the medical field?
That's an interesting question. So I was in third grade, and as part of standing first in my class, we were awarded books. So I got this book on blood where different cells functioned as an army, and I think I got excited at that time about how the human body functions, how complicated it is. And as I grew further, I kind of started enjoying life sciences. So I knew that I wanted to do something related to living beings or humans. And I always wanted to help society. So I thought that there are two ways: either you work and then you do philanthropic activities, or you just pick up a profession where you're helping someone every day. And that's when I decided that, okay, I'm going to pick up medicine because I enjoy it intellectually, but I'm also giving back to the society and helping people.
Mm-hmm. And you are a pediatrician. Why did you choose this specialty?
I did not want to do pediatrics in the beginning. I liked medicine and surgery much more, like every other medical student. And however, I really enjoyed my pediatrics rotation during my medical school. I loved working with children. It was refreshing. The best thing about the kids is their innocence and their resilience. So no matter how sick they are, they're always cheerful. They always get better, and they're always full of hope. And I really enjoyed that. So when I went back home, I was a happier person. So I decided to go for pediatrics because I could see myself doing this for the rest of my life.
Mhm. And can you tell me a little about your specialty?
Yes. So I am going to be practicing um, in a private care facility in primary care pediatrics. I'm mostly going to be seeing children on an outpatient basis, which means in the clinic. Pediatrics is a really interesting field. You have a diverse population. You're seeing babies to up to 18 years of age. And each age group has its own problems. The good thing about general pediatrics is that you see a baby grow and you become a part of their life. So if you enjoy preventive medicine, because being a doctor, it's not just about curing someone from an illness. It's also about making sure they grow up to be healthy individuals, both mentally, physically, and emotionally. And if you enjoy that aspect of the practice, you will really enjoy pediatrics.
Yeah, pediatrics is an interesting field.
Mm-hmm.
Amazing. Yeah. And as you know, the COVID-19 pandemic has really affected the nation and continues to do so. How was it like working during the pandemic?
Very challenging. We were exhausted physically because we were covering long hours. Also, you are kind of anxious about your own safety. Plus, it takes an emotional toll because we were seeing a lot of people dying around, and we really wanted to help, but we had limited information and knowledge about the disease. We didn't have much treatment options. Um, but it was interesting in the sense that, you realize that being a physician, it's a way of life. And at one point, I realized that it was more important for me to save my patient than think about my own life. And it is not something that I thought I could do, but I was very happy because it was then that I realized how physician had become more of a calling and a way of life and not just my profession.
Mhm. And how are you able to help people during this difficult time period?
So we were redeployed, and I was also seeing adult patients, not just children. Um, so yeah, we just tried, to help patients become stable, provide supportive care as much as we can. We covered for each other. All the colleagues who fell sick, we would cover their duties. We gave enough time off uh, to colleagues so that they could get some rest in between during their busy work hours. There
Mm.
was a lot of camaraderie, teamwork. We were trying to write a grant to get PPEs because there was shortage of PPEs at some point. So yeah, it was all a lot of teamwork and trying to help the patients, the colleagues, and the medical staff as much as we could.
Mm. Can you give a few words of advice to the people of my generation hoping to go into the medical field?
Hmm. I would say that take your time uh, to see if you really, really like it, because it's a long haul. It requires a lot of commitment, but if you love medicine, you will enjoy the process, and the journey is as satisfying as the end. So be perseverant, be determined, keep moving ahead, take one little step at a time, and enjoy each small victory as you go along. And you will be fine. You will become a good doctor.
Thank you so much, Dr. Mittal, for joining me, and thank you for your time today.
You're welcome. Thank you so much, Emily.